Now to good health. Warnings about a serious contagious illness has gone out to doctors and parents from a local health department as well as the state of Michigan.
Dr. Frank McGeorge is here with the facts everybody needs to know, especially if you have contact with young children.
That's exactly right, Devin and Kimberly. We're talking about pertussis, or whooping cough. Now, state officials have noticed an increase in cases over the last few months, particularly in children age 4 and younger who have not completed their 5th dose of the pertussis vaccine, and it is now a serious problem. Pierce Elementary School in Birmingham is just one of the many schools recently dealing with pertussis cases.
When we discovered that a child had been confirmed as having whooping cough, pertussis, so we immediately sent a letter to the families in that building, and within a few days we had a second student who also was diagnosed as having whooping cough.
Kathy Forsley is a health officer with the Oakland County Health Department.
Since November 1st, we've seen 56 confirmed cases. We have a significant number that you could say are in daycare ages 4 and under.
One infant was hospitalized and has since been released. Now, because many cases are occurring in children who haven't completed all their vaccinations, it's important to be on the lookout for symptoms, which initially seem like a simple upper respiratory infection, but after a week or two, a severe cough begins. So severe it can be hard for the person to catch their breath or even cause vomiting. Ensuring the children's vaccinations are up to date is important, but don't forget adults.
Adults need to remember that it's important that they keep their boosters up to date, because they should be getting that every 10 years along with their tetanus boosters.
If you are concerned about pertussis,
get into the doctor, get evaluated, get tested, and then there would be a course of antibiotics that would likely be prescribed.
Now, Forsley also noted there is a cyclical nature to pertussis outbreaks. The last one was in 2012, and they occur about every 3 to 5 years, so that may be contributing. All the more reason, though, to be extra vigilant this season.
It does kind of feel like it just pops up every once in a while.
Every now and then.
Exactly.
Hear about it more.
Vaccine's a mainstay, but every now and then it's going to pop up like it is this year.
Yeah.
Okay,
All right,
thanks,
Doc.
Doc.